Are you battling with the relentless symptoms of inflammatory bowel disease, IBD? Don't worry, as relief may be within reach. In this video, we delve into the top 5 medications that can help you fight back against bowel inflammation. From controlling the inflammation to reducing the frequency of flare-ups, these medications have proven to be effective in managing the symptoms of IBD. With the market flooded with various treatment options, it can be overwhelming to choose the right medication for you. That's why we've compiled this comprehensive list, highlighting the key benefits and features of each medication. Whether you're dealing with Crohn's disease or ulcerative colitis, this video will provide you with the information you need to make an informed decision about your treatment. Explore the various options available and discover how these medications work to alleviate your symptoms, improve your quality of life, and help you regain control over your health. By understanding their mechanisms of action and potential side effects, you can work together with your healthcare provider to find the medication that best suits your individual needs. Don't let inflammatory bowel disease control your life. Read on to find out which medications can serve as your strongest allies in the battle against bowel inflammation. Understanding the different types of IBD, Crohn's disease, and ulcerative colitis. Inflammatory bowel disease, IBD, is a chronic condition characterized by inflammation in the digestive tract. The two main types of IBD are Crohn's disease and ulcerative colitis. While both conditions share similarities, they also have distinct differences in terms of the location and nature of inflammation. Crohn's disease can affect any part of the digestive tract, from the mouth to the anus. It often involves deep layers of the bowel wall and can cause inflammation in patches, leading to symptoms such as abdominal pain, diarrhea, and weight loss. Ulcerative colitis, on the other hand, primarily affects the colon and rectum. The inflammation in ulcerative colitis is continuous and typically starts in the rectum and spreads upwards, resulting in symptoms like bloody diarrhea, rectal bleeding, and urgency to have bowel movements. Understanding the specific type of IBD you have is essential for determining the most appropriate medication and treatment plan. Consulting with a gastroenterologist who specializes in IBD will help you navigate through the complexities of these conditions and find the best course of action for your individual case. Common symptoms and complications of IBD. Living with IBD can be challenging due to the wide range of symptoms and potential complications that can arise. While the severity and frequency of symptoms vary from person to person, it's crucial to be aware of the common manifestations of IBD and seek prompt medical attention when necessary. Some of the typical symptoms experienced by individuals with IBD include abdominal pain, cramping, diarrhea, fatigue, and unintended weight loss. These symptoms can significantly impact daily life and quality of life, leading to emotional distress and limitations in social activities. In addition to the primary symptoms, IBD can also increase the risk of developing complications. These complications may include strictures, narrowing of the intestines, fistulas, abnormal connections between organs, abscesses, infected pockets of pus, and even an increased risk of colorectal cancer. Regular monitoring and appropriate treatment can help minimize the risk of complications and manage the symptoms effectively. Overview of the medications used to treat IBD. When it comes to managing IBD, medication plays a crucial role in reducing inflammation, alleviating symptoms, and maintaining remission. The choice of medication depends on various factors, including the type and severity of IBD, the specific symptoms experienced, and individual response to treatment. The following is an overview of the 5 main types of medications commonly used in the treatment of inflammatory bowel disease. Aminosalicylates. Aminosalicylates, also known as 5-ASA drugs, are often the first-line treatment for mild to moderate cases of IBD. These medications work by reducing inflammation in the lining of the intestines. Aminosalicylates are available in various forms, including oral tablets, capsules, suppositories, and enemas. One of the advantages of aminosalicylates is their relatively mild side effect profile. Common side effects may include nausea, abdominal pain, and headaches, but these are generally well tolerated. It's important to note that aminosalicylates may not be effective for everyone, and some individuals may require additional medications or therapies to manage their symptoms effectively. Corticosteroids. Corticosteroids, such as prednisone and budesonide, are potent anti-inflammatory drugs used to control moderate to severe flare-ups of IBD. These medications work by suppressing the immune system and reducing inflammation throughout the body. Corticosteroids are typically prescribed for short-term use to induce remission during acute episodes of IBD. While corticosteroids can provide rapid relief, they are associated with a range of potential side effects, especially when used for extended periods. These side effects may include weight gain, mood swings, insomnia, osteoporosis, and increased susceptibility to infections. Due to the risk of long-term complications, corticosteroids are generally not recommended for long-term maintenance therapy. Immunomodulators. Immunomodulators are a class of medications that work by suppressing or modulating the immune system's response. These drugs are often prescribed for individuals who do not respond adequately to aminosalicylates or corticosteroids, or for those who require long-term maintenance therapy. One commonly used immunomodulator for IBD is azathioprine. Azathioprine helps reduce inflammation and maintain remission by inhibiting the production of certain immune cells. However, it may take several weeks or even months before the full benefits of immunomodulators are seen. Regular monitoring of blood counts and liver function is necessary while taking these medications due to the potential for adverse effects. Biologic therapies. Biologic therapies, also known as biologics or biologic agents, are a newer class of medications that target specific proteins or cells involved in the inflammatory process. These medications are usually administered by injection or infusion and are effective in treating moderate to severe cases of IBD. One example of a biologic therapy used in IBD is infliximab. Infliximab works by neutralizing a protein called tumor necrosis factor alpha, TNF-alpha, which plays a key role in inflammation. By blocking TNF-alpha, infliximab helps reduce inflammation and control symptoms. Other biologics, such as adalimumab and vedolizumab, target different pathways involved in the inflammatory response. Biologic therapies have revolutionized the treatment of IBD, offering improved outcomes and quality of life for many patients. However, they do come with potential risks, including an increased susceptibility to infections and the development of rare but serious adverse reactions. Regular monitoring and close communication with your healthcare provider are essential while on biologic therapies. Janus kinase, JAK, inhibitors. Janus kinase, JAK, inhibitors are a newer class of oral medications that work by inhibiting a specific pathway involved in the immune response. These drugs, such as tofacitinib, are used to treat moderate to severe cases of ulcerative colitis when other medications have not been effective. JAK inhibitors offer an alternative treatment option for individuals who may not tolerate or respond to other therapies. However, they also carry potential risks, including an increased risk of infections, liver problems, and changes in blood cell counts. As with all medications, close monitoring and regular follow-up with your healthcare provider are necessary while taking JAK inhibitors. Conclusion and recommendations. Living with inflammatory bowel disease can be challenging, but with the right medications and treatment plan, it is possible to manage the symptoms effectively and achieve remission. The top 5 medications discussed in this video, including aminosalicylates, corticosteroids, immunomodulators, biologic therapies, and JAK inhibitors, offer a range of options for individuals with IBD. It's important to remember that each person's experience with IBD is unique, and the choice of medication should be tailored to their specific needs and circumstances. Consulting with a gastroenterologist who specializes in IBD is crucial for developing an individualized treatment plan and ensuring the best possible outcomes. In addition to medication, lifestyle modifications such as adopting a healthy diet, managing stress levels, and getting regular exercise can also play a significant role in managing IBD. Working closely with your healthcare team and maintaining open communication will help ensure that you receive the most appropriate and effective treatment for your condition. Remember, you don't have to face the battle against bowel inflammation alone. With the right medications, support, and self-care strategies, you can regain control over your health and live a fulfilling life, free from the burdens of inflammatory bowel disease.